Hi, I'm Dr. Raghu Athre with Athre Plastic Surgery and Med Spa. Welcome to another episode of our podcast. One of the things that I was given a little prompt, which I think is very interesting, is 5 non-invasive treatments that I would recommend that give you bang for buck. So I decided to kind of sit down, think about this, and I've put together a list of 5 treatments which I think really work well and give you a bang for buck that is probably not as proportionate to the price. So let's get started with that. First thing that I put on my list is skincare. Okay, I think skincare is probably the single most important thing in anything we do with respect to plastic surgery. I definitely talk to all my patients after a facelift, after chemical peels, all of these types of procedures about skincare. So most of us don't even think about skincare until we get to the point where we start seeing a few wrinkles and go, whoa, I need to do something about it. So at that point in time, realistically, we're in the repair phase rather than the prevention phase. So if we actually target that a little earlier, we're going to actually have a way better overall result. So I like to think about this kind of like going to the dentist. So if you decide that, hey, I'm going to go to the dentist every 6 months and I'm going to use the appropriate toothpaste and brush my teeth and floss, that type of maintenance early on pays you dividends for the most part down the road. Okay, you're not going to need more expensive procedures, no root canals, no implants, things like that. Okay, I know I'm oversimplifying, but you kind of get the gist of it. Now, if you say, hey, listen, I have a little bit of discoloration in my teeth and I just want to go get Zoom whitening and not worry about anything with respect to the preventative aspect, yeah, you may get a little bit of white teeth in the short term, but long term, you haven't really done anything to impact your teeth. So similarly with skincare, a good regimen involves preventative as well as some degree of reparative and then maintenance. Okay, so all 3 of those things are targeted in a good medical grade skincare regimen. And I know I keep harping on skincare and you're like, there's 10 million products out there. I'm gonna make this real simple for you. Medical grade is different than what you can buy at Walgreens or even at the more expensive department stores. Come in, have one of us, myself or the esthetician, evaluate your skin. We have objective ways of looking at your skin. I call it the egg. It's being able to shoot your skin in different types of polarized light to see what kind of damage exists, what the moisture level is, and all this kinds of stuff to really get a skincare regimen that's targeted to the issues that you're facing. Number 2 is a good facial regimen, okay? Inclusive of facials, dermaplaning, some chemical peels, all of those boxes. And I'll be really honest, I'm not really good at maintaining myself. I talk a big game and I get tied up with work. But realistically, this is a big category that gives you a hell of a lot of dividends with not as much investment. So if you are very how do I say this? If you keep up the small stuff, you don't have to sweat the big stuff down the road. Facial's really good to get rid of some of the dead skin cells and kind of get that skin collagen system reboosted. Chemical peels to amp that up even more, and things like dermaplaning, kind of sloughing off some of those dead skin cells. So a lot of this, I'm putting all of that in a big box, and by speaking to a very good quality medical esthetician like Blaze in her office, she can put a regimen together for you so that you kind of have a blueprint or a game plan of what needs to be done when. Number 3, microneedling. Microneedling is all the rage. It's not snake oil. It's not useful for everything, but it is a procedure that can repair a lot of damage and prevent a lot of damage. What microneedling's really doing is basically putting little micro perforations in the skin, and each one of those little micro perforations serves 2 purposes. One, it actually creates a controlled injury into the skin, which triggers the skin to kind of pump up its reparative mechanisms to increase collagen and such. And then the second thing it does is create temporarily a little channel in that micro perforation so you can put stuff on the skin which sinks into the skin. So useful from both of those perspectives. Again, another procedure, dividends received way more than the investment put in. Places where microneedling is awesome. Under eye area. Works great for that area. Really can trigger and help with a little bit of the crepe-like skin, crow's feet region, generalized acne scarring over the face, fine lines across the forehead. All areas where microneedling works great. Also can really help thicken up hair in this area. So that was number 3. Number 4, IPL. IPL, I think, is one of the best treatments to impact the color quality of the skin. So as we all age, we tend to develop some hyperchromias or little dark spots, age spots, freckles, all these kinds of various things. And IPL is a great treatment in order to kind of give you more of that even complexion. It goes hand in hand with skincare. So the skincare is treating that skin kind of more long-term. IPL gives you that instantaneous reparative mechanism for maintaining that skin coloration. Also is really good for some small telangiectasias or little capillary veins type of thing. So that was number 4. Last but not least, Exilis, number 5. So Exilis is a combination of radio frequency and ultrasound. You've heard me say this before. Basically 2 different types of energy. It's kind of like trying to put some heat into the deeper skin layers and thereby causing remodeling of the underlying tissue layers, creating collagen, tightening it up, as well as burning a little bit of fat. Most of the work that we're doing in the face is more on the remodeling, trying to increase collagen, increase thickness. So it's good for dealing with the texture quality of the skin, whereas the IPL is more on the color purpose of the skin. So if we break this down, like chemical peels, facials, those kind of things is overall superficial texture. Deep underlying texture and support is an Exilis issue, and color is an IPL skincare issue. So this is kind of how all this fits together. And I know this is a lot of stuff being crammed down in a few minutes, but in a nutshell, there are lots of treatments that are available that are not very expensive, that fall in this stitch in time saves 9 category, where if you invest in these down the road, you're getting high dividends to prevent bigger procedures down the road to repair things. If you have questions, please don't hesitate to give us a call. Blaze, who is our esthetician, is an excellent resource. So come in, create a small aesthetics consult. It's complimentary, and she can go in and create a blueprint for you guys with respect to what to do, when to do it, and how to do it. If you have any questions, don't hesitate to give us a shout. Till next time.